Neural signature identifies that people are likely to respond to antidepressant medication. Today I'm going to talk about a paper of title Antidepressant Responsive Brain Signature in Major Depression Defined by Electroencephalography. Antidepressants are widely prescribed, but their efficacy relative to placebo is modest, in part because the clinical diagnosis of major depression encompasses biologically heterogeneous conditions. Here, scientists sought to identify a neurobiological signature of response to antidepressant treatment as compared to placebo. They designed a latent space machine learning algorithm tailored for resting state EEG and applied it to data from the largest image-coupled placebo-controlled antidepressant study. Symptom improvement was robustly predicted in a manner both specific for the antidepressant sertraline and generalizable across different study sites and EEG equipment. This sertraline predictive EEG signature generalized to two depression samples, wherein it reflected general antidepressant medication responsivity and related differentially to a repetitive transcranial magnetic stimulation treatment outcome. Furthermore, they found that the sertraline resting state EEG signature indexed prefrontal neuroresponsivity as measured by concurrent transcranial magnetic stimulation and EEG. Their findings advance the neurobiological understanding of antidepressant treatment through an EEG-tailored computational model and provide a clinical avenue for personalized treatment of depression. There's a great need in psychiatry today for objective tests that can inform treatment and go beyond some of the limitations of the diagnostic system. The findings are exciting because they reflect progress made toward the clinical goal, and the results also show the potential of bringing sophisticated data analytic methods to psychiatry. Major depression is one of the most common mental disorders, affecting about 7% of the adults in the United States in 2017, but the symptoms experienced can vary from one person to another. While some may experience many of the characteristic features, including persistent sad mood, feelings of hopelessness, loss of pleasure, and decreased energy, others may experience only a few. There are several evidence-based options available for treating depression, but determining which treatment is likely to work best for a specific person can be a matter of trial and error. Previous research has suggested that specific components of brain activity, as measured by resting state EEG, could yield insight into how people will respond to certain treatments. However, researchers have yet to develop predictive methods that can differentiate between response to antidepressant medication and response to placebo, and that can also predict outcomes for individual patients. Both features are essential for the neural signature to have clinical relevance. A professor of psychiatry at the University of Texas Southwestern Medical Center, Dallas, and an instructor at Stanford University, California, drew an insight from neuroscience, clinical science, and bioengineering to build an advanced predictive model. The researchers developed a new machine learning algorithm specialized for analyzing EEG data called SELSER, known as a sparse EEG latent space regression. They hypothesized that this algorithm might be able to identify robust and reliable neural signatures of antidepressant treatment response. The researchers used this technique to analyze data, a large randomized clinical trial of the antidepressant medication sertraline, a widely available selective serotonin reuptake inhibitor. known as SSRI. As part of the study, participants with depression were randomly assigned to receive either sertraline or placebo for 8 weeks. The researchers applied this algorithm to participants' pre-treatment EEG data, examining whether the machine learning technique could produce a model that predicted participants' depressive symptoms after treatment. This technique, SEL-SER, which is a sparse EEG latent space regression, was able to reliably predict individual patients' response to sertraline based on a specific type of brain signal known as alpha waves, recorded when participants had their eyes open. This EEG-based model outperformed conventional models that use either EEG data or other types of individual-level data such as symptom severity and demographic characteristics. Analysis of independent data sets using several complementary methods suggested that the predictions made by this new technique, SEL-SER, may extend to broader clinical outcomes beyond sertraline response. In one independent dataset, the researchers found that the EEG-based SEL-SER model predicted greater improvement for participants who had shown partial response to at least one antidepressant medication compared with those who had not responded to two or more medications in line with the patient's clinical outcomes. Another independent dataset showed that participants who were predicted by this technique show little improvement with sertraline, were more likely to respond to treatment involving a specific type of non-invasive brain stimulation called transcranial magnetic stimulation in combination with psychotherapy. Work is now underway to further replicate these findings in large independent samples to determine the value of SEL-SR as a diagnostic tool. According to the researchers, the present research highlights the potential of machine learning for advancing a personalized approach to treatment in depression. Finally, the fact that EEG is a low-cost and accessible tool makes the translation from research to clinical practice more possible in the near term. Researchers believe that their findings are part of a tipping point in the field with respect to the impact of the machine learning and objective testing.